Hi, Dr. Liz here with drlizhypnosis.com and Conversations for Effective Living. Today, I'm going to talk about risk factors for postpartum depression and anxiety, also called PMD, perinatal mood disorder. Okay, so I'm doing a whole series of videos for Maternal Mental Health Week, Awareness Week, which generally runs May 1st through 7th. It runs before Mother's Day every year. So here we go. Let's talk about some risk factors. And I know a lot of these by heart, but not all of them. So you may see me like reading here, all right? Personal history of depression and anxiety. So if that's you, if you already know, I've had an episode of depression, or even I'm like a pretty anxious person, and sometimes it even gets higher anxiety, then that's a risk factor. Family history of depression, anxiety. So if depression, anxiety runs in your family, then you need to keep an eye out for that for yourself. Feeling depressed or highly anxious during your pregnancy. So some anxiety is normal. Like there's some things that pregnant women are anxious about that everybody is anxious about. Okay, I don't know anyone who's not anxious about the birth, right? Or sometimes fears come up around the baby developing normally. That's pretty normal. But when it gets to a certain level where you feel like you're not handling things well and it's really starting to take over, then that's a risk factor for postpartum depression, anxiety, and you need to get some help, meaning see a counselor or call a hotline to get you some help, like that kind of thing. High level of stress, low marital or partner support or satisfaction. So if you're having problems in your marriage and not really feeling supported by your partner, that's a huge risk factor for postpartum depression, anxiety. Low social support, that means not a lot of family nearby, not a lot of friends. Moving during your pregnancy, I'm going to bring this up here because it goes with social support. So a lot of women move during their pregnancy to like a larger house or a new area, and then their social support, like their friends that they had and they hung out with, just sort of goes down, right? So you've got a double whammy there, and those are both factors for postpartum depression, anxiety. Significant financial stress. So this is like if somebody loses their job, something like that. Lack of exercise, physical activity. Now, I know it's hard to exercise when you're pregnant, but simply like a walk, some prenatal yoga, gentle stretching, any of that will help prevent postpartum depression, anxiety, as well as anxiety and depression during your pregnancy. Disappointing or traumatic birth experience. This is not something we control, right? Birth takes its own path, and that's really difficult for women to get sometimes. Like this isn't make your plans, make your birth plans. I'm not saying don't do that, but realize that birth always takes its own path. Okay, and if you had a disappointing or traumatic experience, those thoughts can begin to ruminate postpartum, like I should have done this, I should have done that. Depending on what happened, it can be real trauma going on, like PTSD level trauma. So realize that that is a factor in postpartum depression, anxiety. Wanting to breastfeed, but you can't, or rapid weaning. So wanting to breastfeed and then something happens where you really can't can be very disappointing and send women into postpartum depression, as well as rapid weaning. So when you breastfeed, there's hormones released, oxytocin, which is a bonding hormone, which actually helps prevent and soften postpartum depression, anxiety, like just the release of that hormone. So if you do rapid weaning and all of a sudden you don't have that hormone, sometimes it'll be like, boom, you're right into PPD when perhaps you wouldn't have been otherwise. So the recommendation there is if you can, wean gradually. If you have to go on medication, see if there's an alternative that you can take that's safe for breastfeeding that's going to help you, okay, feel better. And then infant temperament, so a high needs baby or a colicky baby or a baby that was born preterm or in the NICU, like that's extremely stressful, often sends women into postpartum depression, anxiety, feeling like they did something wrong. You didn't, okay? And again, a high needs or a colicky baby where you didn't create that. There's nothing you did during your pregnancy. Believe me, they came out that way. Okay. I volunteered in the NICU, neonatal intensive care unit, for about a year at my local hospital. And it was very apparent, like some babies need to be held all the time and they cried a lot and they demanded that, quote unquote, they demanded it. And other babies were perfectly fine, like lying in their little crib and just chilling out. Okay, that mom's going to have an easier experience postpartum than the mom who has to hold her baby 24/7. So keep that in mind, all right? That's a contributing factor, and it's nothing you did. All right, you can hear more about this on the podcast, episode 25, that's airing, and on the Hypnotize Me podcast. Or also, you can go look at symptoms and risk factors on my website, and of course, there's videos on YouTube too. All right, have a wonderful week.